So in the tradition of the edge, of keeping things short, sharp, and smart, let's welcome our first speaker, Simon Bibby.
Thanks, Daniel. I'm going to start with a story. It's a story of a woman who started a new role in a company. She had worked in this company before. She was aware roughly of the duties she needed to perform. And in this new role, there were some changes. When she looked at the job description, she went to her supervisor and said, "I think this is impossible. I won't be able to do it." The supervisor said, "Well, why don't you have a try? If you've got any problems, come and talk to me." So she decided to do the job. She took it up and she attempted to do it, but soon ran into difficulties. The problem she faced was she was a sales rep. She had to deliver cartons to certain stores, but she found the cartons were far too heavy for her to lift off the back of the truck. And the other problem was the territory she had to cover was far too wide. So she went back to her boss and said, "It's not working." She actually went back on numerous occasions and even put it in writing. At no stage did she say she was suffering mentally or physically in this job. After a while, she started to struggle. There was a slow decline in her health and her mental well-being. She started sleeping badly. She became anxious. She had trouble remembering things and soon lost all motivation to work. She went to her doctor, who referred her to a psychiatrist, and he diagnosed that she was severely depressed as a direct result of the work that she was doing. This is a story that's actually from a famous case that went all the way to the High Court, and she sued the company for negligence and she failed. It's a tragic story, and you always have to think in terms of the people involved in this, because not only would it be her who suffered, it would be her spouse, her children, and her friends who would see a slow decline over time in that person, in a good friend of theirs. I have to say too, I've had experience in one particular place where there was a group of workers where, so tragically, one particular employee decided to take his life. But he didn't really mention much to his colleagues, and suddenly they were left with deep grief for the fact that he had taken his life in the way that he did. In a study released by the Australian Institute this month, it estimates the cost of mental health issues in workplaces between $15.8 and $17.4 billion a year. What they identified is some of the factors that contribute to these problems, mental health in the workplace, are things like workloads being given to employees who can't complete them in the time assigned, long and unpredictable hours, tasks with heavy demands on the employee, but ones which they had limited control over. And sadly, the report also notes that many of these employees were bullied and harassed by management. Now, the significance of the study is much of it considers a time before the pandemic. Now we find ourselves in a completely different context. And for the first time in our lives, we are now facing circumstances which are life-threatening, and that on a global scale. The effect on our collective mental well-being can't be underestimated. And as we move into a very uncertain future, the onset of vaccinations, etc., isn't necessarily going to solve the problem for us. Now, I think at a very deep level, something has changed for us. This man, Charles Taylor, is a famous philosopher. He wrote a book called The Secular Age. In this, he noted that one of the features of living in the modern world is that we have a buffered self. And what he means by that is that as we live in cities and so on, we are buffered from a lot of the harsh effects of the natural world. This leads to a mindset when we tend to think that we can control everything with our science and technology. But a pandemic has shattered that. life is not so buffered anymore. We're now faced with shocking pictures of places like New York City, of all places, digging mass graves. And there also reports of daily death tolls in the thousands across America. And whilst it's been well managed in Australia, and particularly in WA, it's still deeply unsettling to us because we all know it only takes one report of an infection and then we're waiting for the next story, which is that they may have been visiting someone or went to a party with 30 other people. And we're always thinking, is this going to mean an outbreak? Now, this has also had dramatic impacts on our workplaces. If you were fortunate enough to keep your job last year, you then had to face the situation of literally uprooting from working in an office and then working from home. For some, that was terrific. I really enjoyed it. I didn't have all of the normal interruptions of my day. But I soon found out from my colleagues, particularly young mothers, it was a nightmare. We also started to realise we lost something. There was something about working in proximity with other people that was making the job enjoyable. And that now had to be set aside, at least for a time being. What we need to do now, though, is take seriously we're living in very difficult and uncertain times, and we need to find ways and means of supporting each other, particularly in our workplaces. I want to just, in the brief time that I have left, I want to talk about to those groups who have to manage these employees, those employees who may well be struggling with mental health issues, and then lastly, for those of us who aren't struggling with mental health issues but want to know what they can do in the circumstances. From my own personal experience, this is a very difficult thing to manage, particularly when you're dealing with an employee who has maybe left the workplace, notified that they are on stress leave. The time alone in dealing with that matter is huge. I clocked quite recently that in 1 week alone, when I was dealing with one of these matters, it took me 23 hours in terms of all of the issues that I had to deal with. Now, more than ever, we have to find ways and means when we are at work of connecting well with each other. And I'm finding little things can make a big difference. Celebrating birthdays, when you're at the office, going out to lunch together, having coffee, but also for managers just to keep an eye on people and see how they're travelling. If you're working remotely, it becomes even harder, but it's still something that you have to deal with. I have to confess that I was very sceptical about Zoom and what it could do in terms of keeping a team together, but actually our team found a way of doing it, and we produced video diaries of what we did at home, and we got an insight into people which we never had before, so that was quite interesting. But it helped keep us together and helped us checking in on each other and making sure we were okay. Where you start to see an employee struggling, it's really important you get alongside them. Keep in mind the story I opened with. The employee never made it clear that they were struggling mentally. So it may be the case that the employee is just simply not thinking clearly at this point. There might be an awful lot going on for them. So you need to check in with them sensitively and ask them how they're going. If they suddenly absent themselves from the workplace, then you really need to work at how you will build a relationship with them and how you will keep a conversation going, because you need to manage a number of things, and not the least of which is you've got another team of employees around you who are probably taking more work as a result of the absence. Sadly, it may be the case that after some time you find out how long they're going to be off, and this can't go on forever, and you need to understand roughly how long they're going to be away from work, and it is the case it may become unsustainable, and you will need then to get legal advice as to what you can do from there. What happens if you're an employee struggling in this situation where you have a mental health issue? You need to do everything to assist your employer to understand the issues you're facing. You don't have to divulge sensitive information, but you do need to think carefully about their needs, the needs of your boss and the needs of your employees. And critically, you need to keep telling them how long you're going to be off and giving them a rough estimate of when you will come back to work. And you may need a medical professional to help you with that, because it's critical you don't get back to work too early, because you may not be well enough to get back to work, and it could only prolong the problem. And lastly, what about those people who are working in a team alongside of people? All I'm saying to you is you need to be aware of each other and work out ways and means in which you can watch out for people who may well be struggling, and to engage in a conversation with them to see if there's anything you can do to help them. There are many resources available to you to help you with this. One thing that we do in our workplace is we put on the Are You OK Day in September. And during that time, what we do, it goes for a month, and we raise the awareness for people in the workplace of both the issue of mental health, but also some very careful strategies of what people can do to invite and open up conversations. So, I'll conclude by saying this. We're living in very difficult times, and it is the place where, for many of us, we spend most of our time, and we need to find ways of supporting each other. We need to discover the practices that we need to put in place to be good communities. Managers have to care for staff as best they're able. Employees need to realise ways of getting alongside of people who may be struggling. And an employee who is in that situation needs to find ways and means of communicating with their employer how long they're going to be off work. But in all these things, what I'm saying is working hard at it is really important at this time, in this strange times that we live in.